Okay, so you're considering lens replacement surgery. That's a big decision. And it's understandable to want all the facts before diving in. That's what this deep dive is all about, arming you with the knowledge to make the best choice for your vision. Now, I've been going through this really interesting article about the latest advancements in lens replacement. And let me tell you, it's not just about cataracts anymore. Joining me to help unpack all of this is a board-certified ophthalmologist who's helped countless patients achieve clearer vision. So before we get into the nitty-gritty of different procedures and options, let's start with the basics. What exactly is lens replacement surgery?
In the simplest terms, it's any procedure where we either replace or enhance the natural lens in your eye to improve your vision.
Okay, that makes sense, but isn't that what a LASIK does too?
Good question. LASIK reshapes the cornea, which is the front part of your eye. Lens replacement, as the name suggests, focuses on the lens, which sits deeper within the eye.
Uh, I see the difference. So why would someone choose lens replacement over something like LASIK?
There are a few reasons. Sometimes LASIK isn't an option, perhaps due to the shape of the cornea or the severity of the vision problem. Other times, lens replacement might be a better long-term solution, especially for those approaching the age when cataracts become more common.
Because this is surgery on the actual lens, which is what cataracts cloud up,
Right,
right?
exactly. And this is where things get interesting. You see, lens replacement surgery isn't just about cataracts anymore. It can actually prevent them.
Wait, really? That's amazing. I never knew that was even possible. So you're saying that by having this surgery, even before cataracts develop, you could potentially avoid them altogether?
In many cases, yes. It's like taking a proactive approach to your eye health. And that's just one of the reasons why more and more people are considering lens replacement, even if they don't have cataracts yet.
That's a game changer for sure. So besides this whole cataract prevention thing, what other vision problems can lens replacement address?
The big ones are refractive errors, things you're probably familiar with like nearsightedness, farsightedness, and astigmatism.
Those are the ones that usually have us reaching for glasses or contacts.
Exactly. And what's so exciting about lens replacement is that it has the potential to give you clearer vision than you've ever had before, even if you've worn glasses your whole life.
Okay. I'm starting to see why someone might be really interested in this, but I imagine it's not a one-size-fits-all kind of surgery, right?
You're absolutely right. There are two main approaches we use, and the best one for you depends on your specific needs and the overall health of your eyes.
Okay, let's unpack those approaches. What are we talking about here?
The first approach involves replacing your natural lens entirely. There are two main procedures that fall into this category: refractive lens exchange, or RLE, and cataract surgery.
So even though both RLE and cataract surgery involve replacing the lens, they have different goals.
Exactly. Cataract surgery, as you might guess, is primarily for removing a lens that has become cloudy due to cataracts. RLE, on the other hand, is more about vision correction. Think of it like this. Cataract surgery restores your vision to what it was before the cataracts developed, while RLE aims to give you the clearest vision possible, potentially even better than you had before.
That's a really important distinction. So even though the surgical procedure might look similar, the desired outcome is different.
Precisely. It's about tailoring the approach to each patient's individual needs and expectations.
Okay, that makes sense. Now, you mentioned that replacing the natural lens is just one approach. What's the other option?
The other approach is to add a supplementary lens, kind of like adding a special filter to a camera lens.
So in this case, you're not removing the natural lens, just enhancing it.
Exactly. This is where a procedure called implantable columnar lens, or ICL, comes in. It's a fascinating technique that we can discuss in more detail later.
This is already blowing my mind. Okay, so we've got our two main approaches: lens replacement with procedures like RLE and cataract surgery, and lens enhancement with ICL. Let's dive a little deeper into each of these, starting with RLE. What should someone considering this procedure know?
RLE is often a good option for people with more severe vision problems, those who aren't good candidates for a LASIK, or those who want to address presbyopia.
Presbyopia, that's the one where you need reading glasses, right? I swear I woke up one day and suddenly couldn't read a menu without holding it at arm's length.
You're describing it perfectly. It happens to most of us as we age. And remember how we talked about RLE potentially preventing cataracts? Well, it's also a great solution for presbyopia because those new lenses are designed to give you clear vision at all distances.
So it's like hitting two birds with one stone, addressing your current vision needs and potentially preventing future problems. That's pretty amazing. But let's say someone is considering RLE. What's the first step?
It all starts with a comprehensive eye exam and a conversation about your overall health and your vision goals. We want to make sure RLE is the right fit for you.
So it's not just about, yep, you need new lenses, let's schedule the surgery.
Not at all. We take a lot of measurements to determine the best type of intraocular lens, or IOL, for your specific needs.
IOL, that's the artificial lens that replaces your natural lens, right?
Exactly. And these IOLs are designed to last a lifetime, so choosing the right one is crucial.
No pressure there. So walk me through this. What happens during the actual RLE procedure?
It's actually less complicated than people imagine. It's typically an outpatient procedure, so you go home the same day.
That's always good to hear. Nobody wants to spend the night in the eye doctor's office.
Definitely not. You'll get numbing eye drops so you won't feel any pain. The surgeon makes a tiny incision, removes the natural lens, and inserts the new IOL. It usually takes less than 30 minutes per eye.
Wow, that's much quicker than I expected. What about recovery? What can someone expect after RLE?
You might experience some blurry vision, light sensitivity, maybe a little scratchiness in the first few days. It's important to avoid rubbing your eyes and to use the prescribed eye drops, but most people can get back to work and their normal routines within a few days to a week.
That's good to know. So it seems like RLE could be a great option for a lot of people. But I know another common type of lens replacement surgery is cataract surgery.
You're right. And while the surgical procedure for cataract surgery is similar to RLE, the goal is different. With cataract surgery, we're focused on removing the clouded lens that's causing vision problems.
Those pesky cataracts. But I've heard cataract surgery is one of the safest and most successful surgeries out there. Is that true?
It is. Cataract surgery has a really high success rate, close to 99%. Millions of people have it done each year with excellent results.
That's reassuring. But I'm guessing not everyone with cataracts automatically needs surgery, right?
Right. In the early stages, cataracts might not be that bothersome. And things like brighter lighting or new glasses might be enough. But if cataracts start interfering with your daily life, that's when we start talking about surgery.
It's all about finding that tipping point where the benefits outweigh the risks.
Exactly. And just like with RLE, we carefully choose the type of IOL used in cataract surgery based on each person's individual needs.
So whether it's RLE or cataract surgery, that personalized approach is key. Speaking of IOLs, let's talk about those in a bit more detail. I know there are several types. What's the deal with all those options?
You're right. There are a few different types of IOLs, each designed for different vision needs. One way to think about it is like choosing between different types of eyeglasses.
Okay, I like that analogy. So tell me more about these IOL options. What are the main types?
Well, we have monofocal IOLs, which are like single vision eyeglasses. They provide clear vision at one distance, usually far away.
So if you choose a monofocal IOL, you might still need reading glasses for close-up tasks?
That's right. They're great for distance vision, but you'll likely need glasses for other activities.
Got it. So what about people who want to ditch the glasses altogether? What are their options?
That's where multifocal IOLs come in. Think of these like progressive lenses in eyeglasses.
Those no-line bifocals, that's a game changer.
Exactly. Multifocal IOLs are designed to give you a wider range of vision so you can see clearly at multiple distances without glasses, or at least with minimal dependence on them.
That sounds amazing. So you're saying these lenses have different zones built in, just like progressive lenses?
Precisely. Now, it's worth noting that some people might experience a slight halo effect around lights at night with multifocal IOLs. However, for many, the convenience of less reliance on glasses outweighs those minor drawbacks.
It sounds like a small price to pay for clearer vision at all distances.
Exactly. It really depends on your individual needs and preferences. Now, there are also accommodating IOLs, which are like a hybrid between monofocal and multifocal IOLs.
Okay, I'm intrigued. Tell me more about those.
Accommodating IOLs are designed to mimic your eye's natural ability to change focus. It's kind of like the autofocus feature on your phone's camera.
That's a great way to put it. So they adjust depending on what you're looking at.
You got it. While they don't offer the same range of vision as multifocal IOLs, they're a good middle ground for people who want to reduce their dependence on glasses without the potential drawbacks of multifocals.
Okay, that makes sense. So we've covered monofocal, multifocal, and accommodating IOLs. Are there any other types our listeners should know about?
There's one more important type, toric IOLs. These are specifically designed for people with astigmatism.
Astigmatism. That's the one where the shape of your eye causes blurry vision, right?
Exactly. Toric IOLs are a game changer for people with astigmatism because they correct both the astigmatism and any other vision problems at the same time.
So it's like getting two corrections in one.
Precisely.
This is a lot to take in. For someone who isn't an eye doctor, it might seem overwhelming to navigate all these IOL options. How do people decide which one is right for them?
That's where the expertise of your eye doctor comes in. We discuss your lifestyle, your vision goals. And we carefully evaluate your eyes to recommend the IOL that's the best fit.
So it's not like ordering from a menu where you just point and hope for the best. It's a collaborative decision-making process. Yeah.
Exactly. We're in this together. Now, before we move on to recovery, we should touch on ICLs. Remember, those are the lenses we add to enhance the natural lens rather than replacing it.
Right. The ones that are like adding a filter to a camera lens.
ICLs are often a good choice for people who aren't good candidates for other types of lens replacement, perhaps because they have very poor vision or thin corneas.
So ICLs offer an alternative for those who might not qualify for other procedures.
Yes, and the technology has come a long way. The newest ICLs are incredibly advanced, providing exceptional visual quality and a wide field of vision.
Sounds impressive. So how does ICL surgery work?
It's similar to the other procedures we've discussed. It's an outpatient procedure, and you'll have numbing eye drops so you won't feel pain. We make a tiny incision in the cornea and insert the ICL.
Where does the ICL go exactly?
It sits behind the iris, which is the colored part of your eye, and in front of the natural lens.
So it's like adding a custom-made contact lens that's permanently implanted.
That's a good way to think about it. And here's something remarkable about ICLs. They're removable. So if your vision changes significantly down the road, the ICL can be taken out or replaced.
Wow, that's amazing. I bet that reversibility provides a lot of peace of mind.
You're right. Many people find it reassuring.
So ICLs are an option for those who aren't good candidates for RLE or cataract surgery. And they're also removable. Are there any other factors that might make someone a good fit for ICLs?
They can be a good choice for people who are younger and not yet ready for lens replacement, those at risk for dry eye, or people who are very active and involved in contact sports where there's a higher risk of eye injury.
It seems like there's a lot to consider when choosing the right type of lens replacement surgery. This really highlights how important it is to have that open conversation with your eye doctor.
I couldn't agree more. It's all about finding the best option for your individual needs and circumstances.
Well said. So let's talk about what happens after the surgery. Regardless of which type of lens replacement someone chooses, what does the recovery process look like? So we've talked about the different procedures and the IOL options, but what about recovery? What can someone realistically expect after lens replacement surgery?
Well, the good news is recovery is usually pretty quick and straightforward. You might have some blurry vision, some light sensitivity, and maybe a bit of a gritty feeling in your eye for a few days.
Kind of like having sand in your eye. That doesn't sound fun.
It's not the most comfortable feeling,
Yeah.
but it usually subsides pretty quickly. We'll give you eye drops to help with that. And to prevent infection, the most important thing is to avoid rubbing your eyes and to follow all the post-op instructions.
So no eye rubbing dance parties after surgery. Got it. What about getting back to normal life? Things like work, driving, reading. How long does that usually take?
Most people can return to work within a few days to a week, depending on their job and how quickly they heal. You'll need to avoid driving until your vision clears up and your doctor gives you the okay. Reading and using screens might be a little blurry at first, but it should improve as your eye heals. Just remember to take breaks and avoid straining your eyes.
So basically listen to your body and your doctor, and don't try to push it too soon.
Exactly. And keep in mind, if you're having both eyes done, the procedures are usually scheduled a few weeks apart to allow the first eye to heal properly.
That makes sense. So it's important to factor that into your recovery timeline. Now let's talk about something that I'm sure is on everyone's mind, potential risks and complications. While we've talked about how safe and effective these procedures are, any surgery comes with some inherent risks, right?
You're right. It's important to be aware of the potential downsides. While complications are relatively rare, they can happen.
So what are some of the things people should be aware of?
Some of the more common. Those still infrequent complications include things like infection, inflammation, increased eye pressure, or in very rare cases, even retinal detachment.
Those sound serious. Are those things that can be treated if they do occur?
Absolutely. Most of these complications can be managed effectively if they're caught early. That's why those postoperative checkups are so crucial.
Those follow-up appointments are definitely not something to skip.
And what about long-term risks? Are there any concerns down the road that people should be aware of?
In very rare cases, some people might experience halos or glare-around lights, especially at night, or have a little difficulty with contrast sensitivity. And while those artificial lenses are designed to last a lifetime, there's a tiny chance they might need to be repositioned or replaced at some point.
So it's all about weighing those risks, even the rare ones, against the potential benefits of clearer vision.
Precisely. And that's a conversation you have with your doctor. We'll assess your individual risk factors and give you a realistic idea of what to expect.
Transparency and open communication are key. And speaking of transparency, we should probably acknowledge that lens replacement surgery,
Fair.
while incredibly effective, is still a more invasive procedure than something like ASIC. That's an important distinction. LASIK reshapes the surface of your eye, while lens replacement involves working within the eye itself, removing and replacing the natural lens.
So the recovery might be a bit longer, and there's a slightly higher risk of complications compared to laser vision correction.
That's true. But on the flip side, lens replacement can often address more significant vision problems and might be a viable option for people who aren't good candidates for LASIK or other laser procedures.
It's all about finding the best solution for each individual case. And at the end of the day, the vast majority of these surgeries are successful.
Absolutely. We're talking about a 99% success rate. For procedures like cataract surgery and RLE, that's incredibly high.
That is reassuring to hear. And from everything we've learned today, it seems like lens replacement surgeries have come a long way, with advanced technology and techniques constantly evolving.
You're right. It's an exciting field. And the advancements we're seeing are truly remarkable.
Well, I feel like I've gained a whole new understanding of lens replacement surgery today. It's amazing how far things have come. A huge thank you to our expert for being here and sharing your knowledge.
It's been my pleasure. I'm always happy to help people understand their options.
And to our listeners, we hope this deep dive has given you a clearer picture of lens replacement surgery and what to expect. If you're considering this procedure, remember to consult with a qualified eye doctor to discuss your individual needs and make the best decision for your vision. Until next time, stay curious and keep exploring the fascinating world around us.